Wildfire smoke contains many things. You'll hear people talk about PM 2.5. PM 2.5 refers to ultrafine particles. These are actually made from very tiny soot particles that come off of when you burn wood. Those can be inhaled deep into the lung. And so they become problematic because now we respond to them as essentially a foreign object that we've inhaled. They cause damage, they cause oxidative stress, they cause inflammatory response that can linger in vulnerable populations. So wildfire smoke contains these ultrafine particulates, which are not good for us, but they also contain other toxicants or chemicals, including polyaromatic hydrocarbons, also known as PAHs, if you see them abbreviated, as well as volatile organic compounds. So collectively, these things can cause quite an insult, damage to the tissue and the cells in our lungs when we inhale them, and collectively you get this inflammatory and oxidative stress response. The vulnerability comes to the general population, but more so to individuals that have an underlying chronic disease like asthma or chronic obstructive pulmonary disease, where one of the features is persistent lung inflammation. The other vulnerable populations are the very young, so infants, and people, let's say 65 and older. Other chronic conditions are not immune to this, so heart disease, diabetes, chronic kidney disease. Individuals with those conditions are also more susceptible. There are a number of things you can do to overcome the difficulties that you might face. First amongst those would be for you to consider wearing an N95 mask. So these need to be fitted appropriately, and they can very nicely filter out the ultrafine particulates that are made up of soot aggregates from wildfire smoke. They will not reduce the volatile organic compounds or the polyaromatic hydrocarbons that are in the air. So you do need to understand they're not a perfect solution. The other thing you can do, particularly when the air is bad and you are in a vulnerable population, is stay inside. Seal the windows of your house. Most people have HVAC systems that allow you to set it on recirculate. So you have a fresh air intake, which is a very nice thing to have, but you want to shut that off. The last thing you can do is you can either purchase a commercial air filter, HEPA, containing a HEPA filter, or you can actually make your own. If you go to the Manitoba Lung Association website, for example, they tell you how to get a cheap box fan and a furnace filter, and you can make your own HEPA filter for your house. Those work very well to reduce the particulates we're trying to avoid.